I think this idea of the clean subject, the well individual, it is actually the source of so much further and deeper wounding for so many of us, because I'm not quite sure even what it is, this idealized imagining. I think so many of us, I think, are actually kind of moving through the world in a trance of unworthiness, a feeling of deficiency or kind of inadequacy that we're bearing that weight as if it's our own individual failure because
Right.
we are not meeting this sense of idealized wellness.
Yes.
It comes into this kind of the myth of normality. What does that actually look like? And I think we sometimes get into, the idea of much of it is measured uh, in the kind of context of capitalism to continue producing, to
Mhm.
continue contributing to a quote unquote well society.
Mhm.
And I think in a way, the therapeutic space has become another manifestation of this hyper individualized self importance in which we kind of seek another thing to gain. What do I mean? What I mean by this is this becomes another means of individual self improvement to increase my individual value and increase my capital by being quote unquote therapeutically better. Maybe I am now more worthy of relationship or or seen as more valuable in this world.
I
Yes.
don't know how so now you're a clinical psychologist, you're a PhD.
Mhm.
Um, how did you survive carrying these scandalous artifacts through the hallways of academia? Say something about your journey through that.
I think I entered into the work through really sort of living on the edges of a lot of violences. I think many of us are called into this work
Mm.
through our own survival. I was very, very young actually when I had my first encounters with the mental health system. I was maybe I think about 11, and through my teens, I was a patient, or one might give me that name. Um, and my experiences, I think, were often ones of deep disappointment and longing. I think I was predominantly seeing kind of white middle class psychologists that were reinforcing the ideology of my sickness or illness, and nothing quite seemed to work for me, whether it was medication or therapy. The worlds that were on either side of the skin were not being attended to. Uh,
Mm.
and I think in many ways it drove me to the work. But if I'm being really honest, though, it's a slightly shame-soaked admission. I think I was also kind of carrying this sense of deficiency that maybe if I was to become a professional helper, maybe then I'm further away from the wounding. If I'm if I can occupy the role of the fixer, you know, as if there is something to fix. And really, I think the journey has been a painful one of essentially, I think, uh, thinking I am getting some kind of knowledge to get me to a place of expertise,
Right.
which actually that I've completely thrown that away. So I'm so much more interested in not knowing than claiming a knowing of anything at all. And I think especially within the context of our pain.
Right.
Um, there's something about, I think, the training process that I now have come out on the other side and want to just let it all go. In the sense that, I mean, it affords me something in the sense that, we are living in these systems of hierarchy. We can't entirely escape them. And there is a reality that my voice has I guess people might take it a bit more seriously what I'm saying because I have a
Yes.
doctor in front of my name.
Yes.
And so I lean into it and I harness that. And I also invite us to question that authority even when I'm speaking,
What?
And so that I'm this piece that you were talking about, we started with the kind of the continual emergence.
Yes.
I try to come back more and more to that, really in my work.